Howdy, I'm Dr. George Valdez. My first consideration in prescribing medical marijuana was with patients who were hopeless and had a terrible quality of life. There were patients on multiple antipsychotics and benzodiazepines who were unable to find the balance between being agitated and aggressive or being overly sedated and unable to have quality of life. After going through a tremendous amount of training and diligence, I started prescribing to this population and noticed consistent improvement in severity of several symptoms. There are different types of dementia. Often people don't realize that people with dementia are usually aware that they are losing their ability to remember and think. This loss of control of their function and independence creates tremendous anxiety that comes out in many different ways. Sleep schedules and sleep quality are often interrupted. Appetite is often poor. Arthritis and pain from a deteriorating body is a common underlying stress that also affects mood. After having consistent safety, improvement in symptoms, and quality of life with increasing experience, my recommendation for medical marijuana is changing from last line treatment to one of the first. There are actually plenty of patients with mild to advanced dementia that have a great mood and great quality of life. These are not people who are appropriate. I have tremendous training and experience and prescribe a multitude of medications for complex medical and psychiatric conditions. The average age of patients I treat is about 88, and the average number of prescriptions is probably around 25. For these complex and fragile people, it makes sense to reduce prescriptions with options that have proven safety and potential effectiveness. These days, when I come across a person with dementia who is on or requires medication for mood, sleep, appetite, or pain, and isn't tolerating their current regimen or have a reasonable quality of life, I encourage the family very strongly to consider medical marijuana. It is milder and safer than many prescriptions. Medical marijuana is THC combined with CBD. CBD is available over the counter and is helpful for certain conditions. There are other chemicals as well, called terpenes, which also influence various symptoms. Simply put, the prescription form is like putting different instruments together to produce musical harmony. On that topic, music, dancing, and laughing also help produce very similar chemicals that influence the endocannabinoid system. We have forms on our website which actively gather information to add to the body of evidence and may help form guidelines in the future. I am board certified in hospice and palliative care and frequently consult with many hospice agencies to successfully reduce pill burden and increase quality of life. Keep in mind, our consultation fee and the cost of medication are not covered as hospice benefits. However, families usually find it is worth trying an option that allows their loved one reduce suffering with less side effects than opiates and benzos. So, let's say you definitely want to consider it and you want to know how the process of prescribing works. First, we need to define our goals and expectations. It is critical in the world of dementia to work with the patient, the family, and the caretakers. The family knows the patient best and longest, and if the patient is unable to, can speak on behalf of the patient. The goal may be better sleep, less agitation, less sadness, better intake of food, or less constant pain. The caretakers are the ones that interact on a day-to-day basis and help with the activities of daily living. For them, they may appreciate more alertness due to better sleep quality and food intake, better cooperation with bathing, feeding, and greater sense of contentment with things around them. These are our overall goals. I emphasize with everyone to not expect anything sudden or dramatic to improve. It is best to start low and go slow with most medication, including this one. We usually start at a bedtime schedule to make sure it is tolerated, then increase slowly as needed and steadily watch for improvement of symptoms or any signs of intolerance. We have a consistently positive response, but rarely there are signs of increased confusion or lethargy. We simply reduce or discontinue, and there's no withdrawal or danger of suddenly stopping. Next, we decide on the formulation to use. There are various formulations available, but when it comes to dementia, we usually start with gummies or liquid tincture. Gummies are usually seen as candy to the patient and often accepted by patients who are otherwise agitated and refuse pills. They are easy to handle, store, and dispense. The tincture is a liquid which is preferred for those who have swallowing difficulties or don't like gummies. The other benefit is it can be fine-tuned in much smaller amounts for those who are particularly sensitive. The difficulty with it is some people are uncomfortable measuring quantities from a dropper, it can be more awkward to store, and some facilities require pre-filled syringes. It is also important to differentiate if there is a particularly increased need for better sleep quality. Once the conditions and medications are reviewed, goals are established, and we've decided on the formulation, the doctor will enter the information into the Texas Compassionate Use Registry. This is a controlled and regulated system. In order to complete registration, we need the person's approximate weight, just a ballpark, and also the last 5 numbers, not 4, of the Social Security number. People with dementia are unable to order and coordinate delivery of the medication, so there must be a designated legal guardian of it, which is usually their medical power of attorney or another trusted person. They will be registered in the system as well in order to have permission to receive, transport it to the patient. This means if the medical marijuana is delivered to a legal guardian and they are stopped by the police for whatever reason, the police only have access to the system to confirm that the legal guardian has permission to have it with them. This information is otherwise not accessed or shared. Once the legal guardian receives the medication, they notify the doctor, who sends orders to the facility where the patient lives with clear instructions, and also inform the facility staff that they are to manage it like they manage other controlled medications. That's all there is to it. From there, it is a matter of adjusting the medication depending on the patient's response. Often patients are suffering and have poorly controlled symptoms, so the initial goal is to have better control and better quality of life over the first few weeks. Over the next few months, the goal is actively decreasing prescription medications. Families and caretakers are encouraged to use our patient check-in forms available on our website, initially every 2 weeks and after that once per month, to gather data and evidence. Keep in mind, medical marijuana is not covered by insurance yet. Over time, one of my goals is to prove its value and cost savings compared to traditional medications, but currently it is out of pocket. For most people taking the usual doses, the cost is around $100 a month, give or take. The actual cost depends varying on the type of form, quantity, and the dispensary, which is basically the pharmacy for the medical marijuana. Other costs may be shipping and delivery, and if there are any specials or discounts available, but all of those things are dependent on the dispensary. The doctor will let you know the period of time for which the prescription is good for. When a refill is needed, do not contact the doctor first. There is often a supply still available, so the dispensary should be contacted first, and they will let you know when it is time to call the doctor. There's still a lack of information, confusion, and misunderstanding about the endocannabinoid system and the proper use of medical marijuana. This is an exciting time to be able to provide a safe and effective option to improve quality of life in the later years. It's on all of us to do it right, contribute to better evidence, and share the information and positive experiences. Thank you so much for tuning in. Be sure to follow us for updates and more information. Bye-bye.